Cataract surgery. The average person comes to the office here with blurred vision. One of the number one complaints in the office is blurred vision. And a lot of times those patients have cataracts. They say that over 90% of the people over the age of 60, 65 have some sort of cataract change. Does that mean everyone over 60 or at 60 needs their cataracts done? Of course the answer is no. What it means is that we know that cataracts are present in people over the age of 60, the majority of people, and that these people should be screened, and that we should see if the cataracts themselves are starting to limit their vision. When you come into the office here for a cataract evaluation, there's a process that we put you through. And basically we want to have a thorough exam to make sure that we know your eye inside and out. So basically, when you come here, we do a dilated exam, we take a look at your cataracts, we examine your retinas, we examine the overall health of your eyes. If we determine that cataract surgery will be beneficial to you, we then do a series of tests. One of the tests we do is called an A-scan. An A-scan helps us calculate what lens power or of the lens that we end up putting into your eye. Another test that we do is a topography to check out the curvature of your cornea and to evaluate how much astigmatism you have and if there's any irregularities in your cornea itself. We also do calculations when it relates to the lens as well as what type of lens you might want. Now there's several options for what kind of lens you can have after cataract surgery. When we talk about astigmatism, I get asked a lot, what is astigmatism? Well, if you use an analogy of astigmatism is the ideal cornea, which is the dome over the surface of your eye, over the front of your eye. The cornea should be like a basketball. If you took a basketball and cut it in half and set that half a basketball on a counter, every way you went over the basketball, it's the exact same curvature. That would be an ideal corneal curvature. Now if you took a football, cut that in half, laid that on the counter, you've got a short way over the football edge, and then you've got a long way. The long way would be an example of an astigmatism. So when you have someone with astigmatism, their eye or their cornea is more shaped like a football than it is a basketball, half a basketball. So when someone has an astigmatism, there's a couple options we can do. One is that we can make a relaxing incision in the cornea at the time of surgery. And that in turn releases a little bit of the astigmatism, and then in turn allows us to have a cornea more shaped like a basketball after we're done. Now that's ideal for smaller amounts of astigmatism. Now once you have a moderate to a large amount of astigmatism, that relaxed incision usually doesn't work as well. So that's when we opt to do a toric lens. A toric lens is a lens implant that has astigmatism built into it. So if you in turn are a candidate for a toric lens, that's ideal. We can get rid of your astigmatism at the same time as we're getting rid of need for glasses at distance. So put those two together. If you're nearsighted, which means you have a minus prescription, or farsighted, which means you have a plus prescription, you can in turn put a lens implant in that eye and try and get people so they can see pretty good at distance without glasses. Now if you have a large astigmatism, those lenses for nearsighted and farsighted people alone are not going to work as well because you'll still need your glasses afterwards because your astigmatism will still be there. But if we have a lens in your eye that has astigmatism built into it, we dilate it into the position so it's lined up with your astigmatism in your eye, and that in turn usually alleviates a majority of your astigmatism after cataract surgery. So when we do the A-scan and the topography in the office, we in turn measure for your astigmatism as well as the length of your eye and do special calculations so we know the power of the lens that has to go in your eye. But in all actuality, we can get rid of your astigmatism with this technology.